Wonderful. Thank you so much. Hi, everyone. Just wanting to make sure that you can see the screen okay. Is everyone, or maybe the Sissy team, you are still seeing my screen okay?
Yes, looks good, Kara.
Okay, perfect. Thank you. You know, I hit a button and then I panicked. So, welcome. Thank you guys for being here. I'm not sure where you are in the country, but for me, it's noon. So we are going to focus on canine separation anxiety. But first, as always, I like to give a shout out to Assisi Animal Health for them to continue to provide continuing education on a variety of topics that our pets suffer with. Throughout this pandemic has been just incredible. And to provide these for free, you know, you just don't see that. So thank you to Assisi, one, for having me, because I'd love to present to everyone, as you guys know, and two, for providing these. So again, a huge shout out. Thank you guys. So we know that dogs are social animals, and really by nature, they prefer the company of people or animals to solitude. Even dogs that appear like really independent, you know, maybe they spend hours napping in a distant bedroom, they still are basing their independence on the fact that their owners aren't far away. And as many of us know, there's a world of difference between dogs who wander to a quiet spot in the house and those who are left alone for hours as owners, you know, as we all go to work, we run errands, or, well, prior to COVID, we would be participating in various social activities. So dog personalities, if you think about it, there's a variety of personalities, right? Some dogs seem deeply indifferent about human comings and goings. Okay, obviously after, you know, as long as they have been outside to do their business, right? Which is kind of like the two on the left of the screen. And others, though, are not entirely indifferent, but they resign themselves to the inevitable and sleep through the day. However, there is a problem when dogs left alone do become significantly distressed. And so separation anxiety is what we are, what the veterinary world has diagnosed this as. And truly, canine separation anxiety is a clinical diagnosis. So if you were to bring your distressed pet in and they determined it was, you know, anxiety due to separation, that is a clinical diagnosis. And it's applied to a variety of behavioral issues that have one thing in common. And that is that the dog is left behind by its human owner. It can present in several different ways with a whole range of intensities, right? And you see those, you know, on the screen. Affected dogs might exhibit their distress by destructive chewing, destructive digging, oftentimes at windows, doors, and other exit points, right? They're trying to get out to be with their owner. Sometimes they will urinate and defecate when, you know, when the owner's home, when you guys are home, that never, you know, happens. They're house trained. But as soon as you leave, if they have separation anxiety, one of the signs could be that they do urinate or defecate inside the home. And then there's also persistent vocalization. So they are barking or doing their howl. I mean, even my French bulldogs have this little tiny howl. So most dogs do that, but it can be barking, howling. They are just totally stressed. So this may look familiar. Some owners are convinced that destructive behaviors are like purposefully directed toward them because the pet is retaliating about being left alone or confined. And part of that reasoning is due to the fact that the objects that are commonly damaged belong to the owner. So books that we may have, our clothing, our shoes, the cushions where we sit. And so what these objects have in common is that they're frequently handled by us as the owner, and they carry our scent. And so contact with these items on, our pets are, destroying these items because they're anxious and they serve to remind the pet of the absent owner. And that's going to cause, again, that anxiety that triggers destructive displacement behaviors. But, how many owners, how many of us truly know that our pets are suffering from separation anxiety? Unless evidence is left behind, then we may be completely unaware of our pet's distress. So understanding what dogs do when they're alone is important, because at least 50% of dogs, probably more than 50%, will exhibit some aspect of separation distress at some point in their life. And so, what about us as pet owners? It has a significant impact on us, right? It has a huge impact on that human-animal bond. In addition to the high levels of stress it creates, separation anxiety can have a significant impact, and it has an impact on our lives. As I mentioned, it has a huge impact on the human-animal bond, to the point where owners, many of us on this webinar, choose to stay home 7 days a week to avoid unwanted behavior. And the fallout from separation anxiety, such as destructiveness, may in fact lead some owners to relinquish their pet, their dog, to a shelter, or may even consider euthanasia. So in managing, therefore, we want to be aggressive, but we also have to plan it out with caution to prevent any increase in the dog's anxiety. So when we're trying to manage separation anxiety, it really should be aggressive, but as I said, planned with caution, because we don't want to cause more anxiety, right? The goal of management, the goal of treatment, is to prevent any increase in anxiety. And so what does success look like in or for the dog? Well, successful management of separation anxiety includes teaching the dog to tolerate owner absences and correcting the specific problems of chewing, scratching, digging, barking, or, inside elimination. So how about for us? What does success look like when we try to manage separation anxiety in our pets? What does it look like for us to have a successful treatment plan? Well, what was found in studies, I've mentioned studies before in all my talks, but studies actually have been undertaken, and if we can make it simple, if the veterinary healthcare team can make it simple and make sure that we as pet owners understand, then we will be more compliant and we will see more improvement. So again, I think we as pet owners completely understand what's at stake here, and we want to definitely help. We want to make sure that we can manage this anxiety, decrease it, or get rid of it altogether, which would be ideal. But to do that, we need a simpler approach, so that will enable us to be more compliant and see more improvement in our pets. So I mentioned simplifying. A simplified program that deals with proper homecoming and departures from the home, teaching relaxed independence away from the owners, is going to be a positive step, one that we and our dogs can really get behind to help manage this separation anxiety. So how are we going to do it? Well, one way is we want to decouple departure cues from actual departures. So said another way, we don't want our dogs to associate every time we leave with anxiety, right? We want to decouple those departure cues from truly actual departure. So what we want to do then is work on this part, so the decoupling departure cues, and I'm going to talk through that so it doesn't sound, you know, so weird. Decoupling, it just makes me think of that celebrity who was like uncoupling from their husband or wife or something, and I'm like, what? No, we're talking decoupling certain cues that lead to our dog's anxiety. Okay, so hopefully you guys got that. So by doing that, combined with, you know, drug therapy. So obviously we're going to be working with our veterinary team. And they are going to be the ones that prescribe the medication to help with managing separation anxiety. So we're going to do the behavior, so the decoupling, medication, and then targeted pulse electromagnetic field therapy. So what we're doing is setting the dog up for success. Ta-da! So to do this behavior and environmental modification, we need to focus on that. And if we can, then, you know, what we need to first start with, because this is a behavioral program, is to make sure that us as the owners make arrangements to avoid leaving the dog home alone, okay? We're trying to set that dog up for success. And so by doing that, you know, maybe we can take them to work. Maybe we can have them go to a doggy daycare or leave with a neighbor or a relative or friends. Because again, we're trying to decrease that anxiety and set the dog up for success. We don't want to leave them in a crate. Now, I am a proponent of crate training, but for our super anxious dogs or those with canine separation anxiety, crating, especially when we're trying to manage it and come up with a treatment plan, crating isn't recommended, because as you can see in the lower picture, the dog may try to escape from the crate and cause severe injury to themselves. I've seen this many times, and it's, you know, it's very sad. They're just that anxious. So what else are we going to do? Well, we want to create a safe haven. If the dog is barrier anxious and digging, chewing, or scratching its way through their distress, then we want to identify a dog-proof area, maybe the kitchen or a mudroom, you know, as you come in off the garage, or maybe a spare bedroom. But it should be a safe haven, okay? And it should be a space where the dog on its own chooses to sleep at times, okay? So maybe they do go into a spare bedroom and they feel that that's a safe area, so they do go to sleep there. That can then become its safe haven. And then what we want to do is we want to invest in a tall, depending on, I guess, the size of your dog, but obviously with the two on the presentation, we need a tall one. But so tall, securely bolted, and easily open gate for the safe haven, because many dogs panic when they're faced with a shut door. So we have a safe haven, we have a pretty secure door or gate. They can see through it, okay? So it's not a solid panel. And then as I mentioned, dogs with separation anxiety are stressed, and oftentimes they're traumatized, and they have an impaired ability to learn a new task. So while we're talking about behavior modification for managing canine separation anxiety, first we need to talk about anxiolytic drug therapy, because anxiety medications can help treatment. And in many cases, it will reduce the anxiety more than training or management changes alone. So this is a multimodal approach to managing our canines that are anxious. Okay. Anxiolytic drug therapy, so fancy word for anxiety meds, right? And there are anxiety meds that have been shown to be useful in dogs. And it's also a humane way to help get their anxiety under control, if you will. So it's commonly used to assist with behavior modification. And as I said, it's not only humane, but it truly is helpful. And I'm not saying they have to be on that medication for life. We're focusing on getting them to a comfortable state where we can institute behavior modification and break that association, decouple from cues that they're leaving to relaxation. So we can track progress with journals and videotapes, especially in the time of COVID, right? A baseline for panting, pacing, urination, whining or barking, digging and chewing, as well as the timing and intensity of all those things. We need that, we being the healthcare team now, to determine whether the treatment is working or not. And so video cameras, you've seen them, you know them, and your veterinary healthcare team will help you with ideas of, what are some that can be used. And what we are aiming to do is we want to look at the areas where elimination or destructiveness has occurred. And basically recording 30 to 60 minutes will provide a reasonable idea of the dog's distress immediately after their owner's departure. A journal of the dog's behavior is also helpful and should include elimination behavior outdoors, as well as when the owner leaves the house and returns. So the more information that you as the pet owner can give to the veterinary healthcare team, the better for the pet, and the more streamlined this behavior and this multimodal management. So we want to manage hyperattachment. Dogs that can't adapt to being separated when the owners are home may be less likely to tolerate the owner's actual departures. So, if they're freaking out, if we go into another room and they can't see us, then they're even, hyper attached. So to encourage independence from the owner, then we need to provide a mat, an open crate, or again, that safe haven room where attention is offered when the dog is, sitting or lying down in that area. So we're going to determine, again, that safe haven. And when the dog goes in there, that's when we're going to give them the attention. Okay, that area then can eventually be used when the owner actually leaves. So Also, to help facilitate this process, and because I have to get nutrition in here somehow, right? If we give the dog a food dispensing toy, such as, you know, what you see on the screen here, right? They're food puzzles. They're stimulating the cognition. They're stimulating the dog's mind. And anxious dogs may really benefit from a toy, a food dispensing toy, because the toy distracts and counter conditions. So in other words, it's redirecting the dog's attention to something pleasant during an otherwise unpleasant time. And we should also remember that these food dispensing toys should be offered at other times as well. So they're not associating a stressful event and a trigger for anxiety with the food puzzle or the food dispensing toy. Does that make sense? It's, you know, we have to watch everything so closely because we don't want to cause other issues while we're trying to resolve their separation anxiety. So again, I've talked about this a few times. And so by habituating or getting dogs used to those cues of when the owner is leaving, that can help in dogs that become reactive at the moment of departure. So say you're walking to the door or you open the door and you walk out. Those might be the key trigger times when, you know, the dog becomes super anxious. And so what we're going to do to help with this desensitization process is, again, about a month before, the veterinarian is going to put them on an anti-anxiety medication for, like I said, about a month. And they've already learned to manipulate and play with their food dispensing toys. They have their safe havens. And we're also going to talk about targeted pulsed electromagnetic field therapy. Okay, so let's look at some of these cues. So desensitization begins, and so we have to have repeated exposure, so they become used to, accustomed to those departure cues. So picking up keys, turning off the lights, maybe even putting on a coat. These departure exercises can be and are an important component of separation anxiety management, because what we're doing here is we are helping the dog to disassociate, so not associate those cues from true actual departures. There's a lot of psychology here, psychology that has been tried and true in humans, as well as in dogs. And so we know that this works, but it will take some time and effort on our part. So the owner's part, obviously, as well as the dog's part. So once we get that down, then we're going to change up the ritual a little bit. We're going to have the owner change some of these cues. They're going to maybe leave through a different door, or maybe they're going to go out and put their coat on in the garage, or maybe even park down the street, because we're trying to now change up the cues and lengthen the time and change that ritual, all while they still have their safe haven, their anti-anxiety meds, their food or their brain interactive toys. So when we are trying to desensitize to actual departures, Once the dog has responded well to the simulations, so the habituation to those cues that we've been talking about, and then the changes in those actual departures, now we're going to begin working on desensitization to actual departures. So at first, the departures should be brief and the owner shouldn't leave. The door can be approached, touched, even opened slightly, and then closed. The duration of departure should be determined by videotape. So let me give you an example. If you as the owner leave for 5 minutes, but the dog is only calm for 3 minutes, then obviously 5 minutes is too long, and the time while we're desensitizing should be shortened. So hopefully you're seeing what we as the veterinary healthcare team, including you as the owner and the patient, are trying to do. We're trying to set this dog up for success by reducing his anxiety and getting him used to or desensitized to actual departures. Depending on the dog's tolerance, then the first actual departure may last from a few seconds to a few minutes. And then the length of each subsequent departure should be gradually but randomly increased by a few minutes. So, right, dogs, just like humans, are smart, and they can pick up on if, we are going from 3 minutes to 6 minutes to 9 minutes, right? So we have to change it up. We're still doing the behavior, but the time is going to be randomly increased. Okay, and so the second part of desensitization is, we need to recognize any breaks in their calm behavior. So you can see them on here: rising, approaching the door anxiously. Maybe they start vocalizing like this guy in the picture is doing, or they start really acting nervous. So what happened? Well, that's indicative that the session went too quickly. So we should end the session after a few successful but shorter departures, because again, we are increasing that dog's success by altering what we are doing. And then in subsequent sessions, the dog should participate in less challenging exercise that it can successfully tolerate. Other things to help minimize that difference between when we as pet owners are home and when we're not at home. So, we shouldn't, especially while we are in this desensitization process, we shouldn't change the noise levels. So if you typically have a radio or the television on when you're home, then leave it on during this time period and don't change it. Same with lights and gates. We want to minimize the owner-dog interactions, leaving and returning. And that may be hard for some of us, right? Because we want to give a big, kiss when we're leaving. And then, I mean, what's better than having a dog greet you when we come home? But while we're trying to desensitize and manage their anxiety, we need to minimize those interactions. Sorry, I just had you on mute for a second because of course someone's at the door. So, and my dog, they rang the doorbell and my dog barked, so I apologize for that. So also minimizing the difference between owner presence and absence, we can use white noise machines because they truly do help muffle outside noises and they provide background sound. And it has been shown that that dogs like classical music. It truly is relaxing. On talk radio, you know, if we have a talk radio station that you like, and that the dog has listened to, or you have listened to while the dog is with you, then play that. And obviously avoid punishment. We want to avoid punishing the dog for anxiety-related behavior, because by definition, punishment is an unpleasant is unpleasant, and it's aversive. So whether the dog is chewing, digging, barking, or maybe all of the above, those are manifestations of stress. So when they are doing those behaviors, we know that they are then stressed. And, you know, if coming home is associated with punishment, or maybe we open the door to shout at, or maybe discipline the dog, then their anxiety can worsen. Reprimanding for bad behavior after the behavior takes place is not going to prevent the behavior from recurring. And many of us think that that is the case, especially like with house training for puppies. If we reprimand them after they've urinated or defecated in the house, they're not going to associate our anger, our reprimand, with what they did. They just see us as, you know, upset about something, and they don't know what that is. Exercise. Frequent exercise has a calming effect. It helps to decrease anxiety, and it often just, you know, gets them out. It helps produce those feel-good hormones. So serotonin, dopamine, endorphins. And so by providing, you know, aerobic exercise has a very positive effect in many cases. And you see here, a friendly reminder to wear your mask. So, and yes, it gets all of us out and moving. So I also want to talk to you about Calmer Canine. And this is the targeted pulse electromagnetic field therapy that I've been alluding to as part of this multimodal approach. And I think many of you are familiar with this, but it has been shown to be effective with canine separation anxiety. It's gentle, effective, it's safe, it's drug-free, and what it's doing is it's signaling the area of the brain responsible for the symptoms of anxiety. It's actually signaling the amygdala in the brain. And this is why I love this. It helps to return that anxious brain to a more balanced emotional state. And it's a multimodal tool, and that's what we've been talking about throughout the last half hour. So it includes a comfortable, easy to use vest that holds the device in the proper position over the dog's head, as you can see here. And I'm sorry, but that pitty is adorable. Look at him. He looks like he was born to wear that. Typically, what is recommended is 2 15-minute treatments per day for 4 to 6 weeks. So this, in conjunction with the anti-anxiety medications, the desensitization to habituation cues, the food puzzles, all of this is going to help us beat separation anxiety in our dogs. And it has been shown to reduce canine separation anxiety with lasting effects. Some of those effects that have been studied with the use of Calmer Canine is just what we've been talking about: barking, howling, destruction, panting, watching out the door and windows obsessively, and house soiling. And again, the effects have been lasting. So significantly reduces the signs, improves quality of life, and at the beginning, this is really what we've been focusing on, is how do we reduce canine separation anxiety, because that is going to be successful and improve the quality of life, not only for us as owners, but more so for our pets, and long-lasting results. It also has been shown to help with other types of anxieties. One of my own dogs has a noise phobia, and it has helped her. It's well tolerated, gentle, and the thing that I love most about it is, yes, you can use it as a standalone therapy, but I've seen it so successful as part of that multimodal approach to canine separation anxiety. So we need to be educated on how to prevent separation anxiety, because it does have the potential to recur. But if we can learn how to prevent it from recurring and avoid any problems that may trigger that separation anxiety from returning, then we're doing the right thing by our pet. And we should also, if we are planning a change in our schedule, plan ahead, right? Gradual changes are easily tolerated, or more easily, I should say, by the dog. Medication, if we know we're going away, then we should go back to those anti-anxiety meds 4 weeks prior to the change. As long as we're thinking ahead and planning, that's in the best interest of our dogs to help prevent anxiety. Remember, dogs are social animals. They prefer the company of people and other animals, even if they're not like right next to you. So what we want to do is rebuild that human-animal bond, but it is going to take patience. This is where we want them, right? We want them to just kind of be hanging out. So multimodal management, we talked about desensitization, we talked about anti-anxiety meds, we talked about targeted pulsed electromagnetic field therapy, food dispensing toys, and safe havens. That is a wonderful and successful approach to managing separation anxiety in dogs. And the one other key component is patience. Patience from us while we are trying to get our dog's separation anxiety under control. So thank you very much for your time.